So you can repeat that. Thank you very much. Yeah. Remember the day? So some of us need to be.
You know,
It seems like an.
it's always good reminder. I did a lot of things. Had a lot of things on my phone.
You know. Yeah. And your dad.
Don't
Call
record
mad at you, but.
your contract mouse.
Goes the language.
I've tried to change that.
Well, it's still the case today. I will let you. All right, everybody. Thank you so much for coming today, whether in person or on WebEx, to the Baltimore County Working Group on Resource Coordination to support victims of sexual exploitation, violence, and domestic abuse. My name is Henry Caligari. I am the coordinator for the working group. Before we get started, I just wanted to have a brief moment of silence for the people who lost their lives on October 7th and in the ensuing fighting in the Middle East. All right, so want to begin by doing introductions for people. I know we have some familiar faces here, but also some people who it's their first or second meeting here. So I will start on my right, Chief McCullough.
Chief Rob McCullough, Chief for the Baltimore County Police Department.
Scott Schellenberger, State's Attorney, Baltimore County.
Janine Scott, Chief Attorney, Maryland Legal Aid, Baltimore County Office.
Hi, I'm Danny Ambergoglio. I am the Advocacy Coordinator for GBMC's Sexual Assault Principal Examination and Domestic Violence Program.
Amy Blank, Baltimore County Commission for Women.
Leander Rodriguez, CEO of Turnaround.
Kelly Natalie, Executive Secretary for the Police Accountability Board.
So software, Houston Scott, wholesaler.
Katie O'Malley with Women's Law Center.
Shelby Frank, Executive Director, Family Crisis Center, Baltimore County.
Rebecca Allen, Governor's Office of Crime Prevention and Policy Manager, Victim Services.
Hi, everybody. Mark Millspine, the Director for the Department of Social Services for Baltimore County.
Krista Trahan. I am the co-director of the Child Advocacy Center in Baltimore County.
Juliana Valencia Banks. I use she, her, ella pronouns, Chief of Immigrant Affairs for Baltimore County.
I'm Shelley Hellman, Senator from District 11.
Brian Edwards, Captain with the Police Department, Community and Behavioral Health Support Section.
Hi, everyone. Joy Roberts, Chief of Policy and Implementation, BC staff / Government Reform Strategic Initiatives.
Okay, and last but not least.
Jean Hudson, I'm the Communications Officer.
All right, thank you again for everybody. And then we're actually going to do our WebEx now. I didn't want to miss the folks out or up there. And let me see here. We'll start with our wonderful delegate.
Well, good afternoon, everyone. Apologies for not being there in person, but I'm Delegate Jennifer White Holland. I have the pleasure of representing the 10th Legislative District in Baltimore County.
And from there, we'll just jump in because I don't see everyone's name up there yet. And it's WebEx, so the order is going to be different for everybody on different screens.
Good afternoon. My name is Lisa Nitsch. I'm the Chief Operating Officer for House of Ruth, Maryland. I'm sorry I can't be there today. I'm a bit under the weather.
Emily Shipikoff, I'm the Deputy Director of HANA.
I am Elizabeth Blumenfeld. I am the Program Manager at the Dove Program at Northwest Hospital.
And I'm Michelle Bernstein, a Grants Assistant with Baltimore County.
No, well, love technology. Imran, who I know is from Councilman Young's office. So we will, with that, get started. All right. So the focus of today's meeting is to look at data provided by many of the providers who are here. And I want to begin by saying a major thank you to every provider who sent over data, which was all of those that were asked. And the data that the purpose and the goal of requesting this was really to get a snapshot of the services provided by the providers in Baltimore County. And I think, as everyone here knows, our county is somewhat unique in that we have a large number of providers who are, in some cases, providing overlapping services, but in many cases, each providing a part of the broader map or roadmap for survivor services. So whether it's GBMC versus Dove versus turnaround, there's overlap, but also differences and distinctions. So part of the goal was to get a better idea internally of what services are being provided, but also to get an idea for the purposes of this meeting of a conversation surrounding where the demand is, what services are in demand, what services are most needed that aren't necessarily being able to be met by the providers based on a number of different reasons. The goal is not to put any one provider on the spot or to say, hey, this provider saw X number of people, if this provider saw a larger or smaller number, why? That's not the intent behind this. It's really to help with the next part of the conversation, which is to look at policy recommendations for Baltimore County and for the state of Maryland to the extent that they're applicable, and to make those recommendations by the end of the year. That's the hope of that the county executive will have a list of recommendations and the council will have a list of recommendations sent to them. That's really going to be the majority of the next meeting's focus. We're looking at the end of November, so that way we avoid conflicting with the holidays. I know December, or we may end up with the first week of December, but December in particular is a very difficult month to schedule meetings. So end of November, early December is the hope to have a conversation to discuss and ultimately approve recommendations. They don't need to be, just to table set, the recommendations don't need to be hyper precise to this needs to happen within 6 months or this needs to happen within a year. They can be as broad or precise as this group wants. And the hope is that this working group will continue to meet into 2025 and beyond. So it's not like we need to get every single solution proposed this year. The hope is we can continue to have these meetings going forward because there are going to be new challenges and unique issues that arise in this area. So there's no need to either A, cut it off, that would not be beneficial to the county, or B, to try to make every recommendation all at once, which again, I think becomes a practicality issue of how can we make sure that the solutions that are proposed from this working group are actionable and offer a path forward for Baltimore County to improve outcomes for the survivors and victims of sexual exploitation, violence, and domestic abuse. So we will get started with a presentation that BC Stat put together, our wonderful team. They were the ones who put together the fantastic police department data analysis, and they did the same for the provider analysis. Now, if any providers want to jump in while their data is out there, please do so. Again, the goal here is not to be putting anyone on the spot per se, but it's definitely not to provide data. You know, if there's something which needs context, please jump in because that will just improve the entirety of the conversation. So I'm going to get on and get the screen shared here. Okay, so everyone should be able to see it. That's, yep, there we are. And Joy, you're going to take the lead on. All right, just let me know when you want me to change slides and I'll.
So once again, hi everyone, Joy Roberts. I work with Camilla Stockway and on the BC Stat team. So as Henry said, I'm just going to run through the data. We have been the ones who have made the visuals and have analyzed the data that you have so graciously provided to us. So thank you. But you all are the folks who comes to this. So I'll just kind of call out whose data it is, the things that we looked at, but we will look to you all to actually guide the conversation. So you can go to the first slide. So from the data that we received from everybody, this is just a breakdown of the different years for individuals served from you all, the DV providers, from 2019 to 2023.
And just to provide context here, we didn't ask for 2020 and 2019. This is the data that came in from providers who also shared that. So the numbers are not necessarily, the best 3 years are 21 through 23, and really 2022 and 2023 was when we received the most data. Again, not going to give necessarily the most complete snapshot, but it does give us a good idea of where we are right now in terms of close to 8,000 individuals receiving services from the providers who are covered in this data analysis.
And so to kind of to go off that point, so that's what we're going to look at 2022, 2023, 2019, 2020, and 2021. These bar graphs break down the data that was provided to us from you all. Obviously, 2022, 2023, you're going to see all of the providers. There are some missing bar graphs in the first few years because we don't have data from that time period for those providers. We know it's been collected, but we're really focusing on those years where we have data from the full from 2022 to 2023. So
Sorry. There you were. Yes, Mark.
We're going to break down the post, but go ahead, Mark.
I was just going to ask a clarifying question because we have providers who provided this data, but who serve residents of multiple jurisdictions. Was the data provided specific to Baltimore County residents? That's a question to the providers, not to you, because I know you don't know the right answer.
Based on the questions that were asked, it was all services that were rendered, so it included everybody that we've serviced. But then there is a question where it breaks down geographically where our clients have come from.
And there is one graph, I believe, at the end of that for, I believe it's FCC. There is a breakdown of individuals who receive services who reside in the city versus the county versus other jurisdictions. Okay, so we can go on to the next slide.
I just want to clarify for House of Ruth, Maryland, we did pull out, that is Baltimore County specific data. We did go by the zip code of the service recipient. So it's only the Baltimore County residents that we've served.
Thank you.
So the first group that we're going to look at is CAC. So you can move on to the next slide. Wait, no.
Did it skip two? Yeah, I'm on a little bit of it's lagging a little bit here for me. There we go. Okay.
So thank you. So screening after hours and
This is I know the font's very small here, so just.
So the first group, which makes up obviously the biggest service that is being provided in addition to those others, is for screening after hours call screening. The next group over is screening after hours accepted for investigation services. We have physical abuse, neglect, CPS cases, forensic sex abuse, CPS interviews, calls accepted for in-home family preservation investigative services, and then sex abuse CPS cases, SENC cases, victim advocacy services cases, and then those last few at the bottom or towards the end of the screen is SATP clinical services, referrals received during the fiscal year, and then SATP clinical service psychosexual evaluations only, no treatment. So Stacy also provided staff data. So we have in-home, continuing family, SATP, continuing DV, co-location, SENC, CPS, police, screening age, CPS sex abuse, SAO child abuse, support staff, medical contracted services, victim advocacy, other staff.
Chris, is there anything additional you want to put on that in addition to the numbers themselves?
Not really. She explained it. The screening calls are, you can see there's, over 20,000 cases of screen calls that they did in 2023. That comes, they've just been rising every year. We've worked to get an more and more after hours staff. We've been increasing in sex abuse numbers. You can see the forensic interviews have gone up every year. They did go down a little bit in 2022, but they've gone up again in 23. And the way that sex abuse is set up is that I oversee CPS, a unit of in-home services that specializes in sex abuse, and then we have a clinical team that sees victims and youth with sexual behavior problems. So it's a little bit different than some other jurisdictions.
Sure. And I think one thing that's consistent across providers is that, again, depending on the range of years, that the numbers, at least the last 2 years, seem to be fairly steady in terms of overall numbers, but with a slight increase and some for some of the providers as well. So kind of showing that, again, there wasn't this sort of dramatic change between 22 and 23.
And with victim advocacy services, we are going up every year because we've added students, we've added some grant funded staff. And I think that if we continue to add positions, we'll see that number skyrocket because they're still not meeting the needs of all the victims who are coming through the door. So something more.
I was just gonna say on this staff slide, I want to highlight, so the CAC is unique in that it's not, while we're calling it a provider, it is a provider of service, but it's a it's a partnership, a government partnership between the State's Attorney's Office, the Police Department, DSS, and the Health Department. So you'll see some of the staff listed there are from different departments, right? It's a partnership. So the ones towards the left, except for the police, are the DSS folks, and then there's 37 detectives and a couple civilian staff, I think, but mostly detectives, and then the state's attorney, et cetera.
And the reason I break down sex abuse CPS from physical abuse and neglect CPS is because we're only accredited for sex abuse. I did not break down the police like that. I have all their units under that number of 39, which was there. But that has gone up since then because of, the chief has graciously added another sergeant and a couple more detectives in sex abuse to accommodate the increasing numbers.
All right.
So, Anna? So we were able to look at the data for 2022 and 2023. So 2022, there were more individuals served in 2022 for just total individuals served who initiated support from the provider, and then we have LAP calls responded. You see that dip off in 2023 for LAP calls responded, and a little bit more, like a very slight difference between individuals who were who initiated support from the provider between 2022 and 2023.
And Hannah, I know that most of the folks in this room know this, is kind of a unique position, both in scope, scale, and in geography. So, and community served as well. Let's see, will it go forward? There we go.
Do you want me to wait until the end to provide context?
You can jump in if you'd like right now, Alicia. Yeah.
Okay, so can we go back a slide? So I think an important thing to recognize is that we provide LAP response for the Northwest Precinct of the Baltimore City Police Department. And that LAP model is slightly different from the model that's provided by the Baltimore County Police Department. We provide it because the city and the county do LAP a little bit differently. And we provide that in partnership with the House of Ruth. We have seen this decrease in call volume in the LAPs responded, in the sense that there are less people. So our model in a snapshot is that we receive all of the police reports from the Northwest Precinct. We review all of them. The victims who are receiving that police response are asked whether they want advocate follow-up. And if they answer yes and provide a safe phone number, then that's where we provide follow-up. House of Ruth and Lisa probably will speak more to this, I'm guessing, does that for the rest of Baltimore City. So our model is a little bit different than Baltimore County's, and we have seen over the past couple years that there are less and less people asking for advocate follow-up. So even if those police report numbers stay the same, for which it is still an expenditure of resources because we review every single report, there is a decrease in people asking for follow-up there.
And for those who are not familiar, LAP is the lethality assessment program. Right?
Okay, so from So from left to right, we have individual counseling, number of referrals made, LAP calls responded, which is what we actually just discussed. Crisis intervention, individual advocacy, civil legal assistance with family law issues, protection order assistance, information on victim rights, information about criminal justice process, criminal advocacy, accompaniment, thank you, and shelter. So I don't want to call them drastic, but the differences that we see, or the trend that we kind of saw, was that we're kind of serving more in 2023, and the majority of those groupings than they did in 2022. So that's for all of them, with the exception of protection order, and that's only a bit of a slight difference in civil legal assistance with family law issues. So I'm actually going to pick up on, I actually think that that's a duplicate slide. We can,
All right, we're good.
and so then we're going to move to GBMC.
Alicia, unless there's anything you wanted to add to the context of that previous slide.
Sure. So if you can just be back. So I think the important thing to recognize, and I'd be curious if the other providers feel the same as well, is that this slide really illuminates the number of services provided, but what we've seen really since the pandemic is that the complication of the cases has risen significantly. So even if we could say there would be one session of individual counseling, whereas that session may have lasted, I don't know, 30 minutes in the past, now it is lasting 45 minutes. It is where that person may have availed themselves of like talking to an advocate a couple times, now they're accessing support a lot more. So it's just, I think, all to provide context to like what these numbers all mean is sort of, it's not like apples to apples to apples. It's sort of apples to oranges to bananas to grapes to, every fruit in the grocery store. So the context around it, these numbers are there, but I think what a lot of providers or what at least we are seeing is that the needs of survivors are much more complicated, much more intense, and it is a much greater of expenditure per service and per client than we've ever experienced before.
And that is something that in the process of gathering this data and the conversations that I had with providers, that was consistent to an extent, that it's taken a unique turn post 2020, 2021. All right. GBMC.
Okay, so the navy blue that you're going to see, so this is broken down by year by the different type of service that is being provided. So that navy blue is going to be adult safe exams. Purple is going to be strangulation exams. Pediatric safe exams is in the yellow. And then that orangish red is encounters and consults. So adult safe exams continue to be the higher service that is being provided. In 2023, you see the spike of strangulation exams. 2022, there's still more strangulation exams than the pediatric safe exams and encounters and consults. 2021, there's not as many strangulation exams. The pediatric safe exams is a little bit less than the adult safe exams, but just only by a little bit. And then 2020, which is going to be the year, I won't say that it is the least utilized, but 2020, obviously the pandemic happened. And so to provide context for some of those numbers. So 140 for the adult safe exams, 69 strangulation exams, 94 pediatric safe exams, and 38, even though the encounters or consults stayed pretty standard from 2020 to 2023. The biggest dip you see for that red is going to be in 2022.
So for GBMC, we are an elective program aside from mandatory reporting for child abuse, child sexual assault. So the encounters would be anyone who declines services. I know as of this morning for the advocacy team, I am at 174 for all patients that have accepted an advocate. That does not include the child protection team. We have recently also started up again with the non-acute pediatric cases. We have had a large influx over the last, I'd say, 3-ish months of doing multiple a week. They're usually scheduled out, but then also keeping in mind if someone declines our services who is an adult, intimate partner, domestic violence, sexual assault, that would not be someone we see. It is completely voluntary aside from child abuse, child sexual assault cases. But the non-acute child examinations have skyrocketed for us in the last 3 months. So 2024, I'm assuming, will be much higher than what we're seeing there.
Is there I know it's just guessing at this point, but is there a theory as to why it's gone up so much this year?
I think we have communicated a lot more with the advocacy programs, and then as well as from the city too, that if they report to Center for Hope in the city, then we're getting those. But we've really skyrocketed.
Sure. And that's something that was touched on, I think, with the first meeting, which is when you're looking at these numbers or increased services being provided, some of that is because there's an increased demand, but also some of that's because of better communication with the public and more awareness about these programs. And so it's not necessarily reflecting that there's an increase in the instances of abuse or violence, but rather increases in the awareness of these programs being available to survivors.
Absolutely. And I'm not sure if it's with anyone else, but we have seen such a spike in elder strangulations. I don't know if anyone else has, but we have seen so many. Say in the last 3 months, we've had 12, I want to say, 12 or 13 that we've actually had examinations on.
The strangulation piece, just wanted to comment. I think a lot of that is to your point, Henry, the increased education in the police department.
Oh, yeah.
The early photos and so forth are often deferred to the DVCs for standard injuries to follow up a couple days later. The strangulation cases tend to go over early because of the specialized equipment. And I think some of that is just simply the on ramping of cases specifically for.
Absolutely. And I actually was at Dove doing law enforcement home visits with the DVCs on that side. So I can completely agree with that. The education for that part just isn't there. When I was there, it's not known the specifics on what the strangulation examination guidelines are and what it can and can't do, since the strangulation examination is not medical necessity. If people decline it, they decline it. It is strictly evidence collection.
I'm confused about your response about Center for Hope. Center for Hope lines?
We have recently had a pickup with Baltimore City's CACU or Center for Hope contacting us for cases. We partner with them for all juvenile cases because Mercy only does 12 and up. That shouldn't be included in this graph, but it's the spike we're seeing. We have had a lot.
Are non-acute included in the previous years, like in the yellow, or is that just?
They were. Laura Clary said that they were included on those. Yeah.
Now we're looking at the differentiation between total patients and total safe patients from 2020 all the way up to 2023. There's a higher amount of total patients versus total safe patients, which is the biggest takeaway from this.
So what's considered a safe patient is if we see them for a sexual assault examination, intimate partner domestic violence is considered safe, but we will cover the cost. But as far as the reason in the medical Epic is our medical provider, it would say reported domestic violence versus safe or SAC.
And are you also covering the cost of strangulation services?
If they are coming and having advocacy with us, then yes. If they are having a strangulation examination, yes. If they decline services and they still need the medical side, so the CT with contrast, anything up in the emergency department, then it's a no. But if they see us for advocacy, if they have a strangulation examination, then we do cover it.
Moving into Doug. So first, we're just looking at calls by year. That lighter blue is 2019, navy 2020, yellow 21, red, orange 22, green 23. So we've broken down received calls, hotline black calls from police, and hotline black calls from hospitals.
And again, this reflects the fact that the data that there are fewer cases for some providers during the pandemic. Those numbers, again, as of now, are back for Dove at least to consistent on the top line, at least with the numbers before.
And I know this one gets a little bit hard to read. So that 2019, so those colors are the same. 21 is going to be that purple, yellow 22, and that light blue is 23. So we have clients receiving individual therapy, receiving group therapy, successful home visit with police, receiving financial assistance, receiving legal advocacy, receiving legal consultation, receiving legal representation, receiving child therapy, adults and children in shelters. The year that we're missing for that seems to be 21. And then clients receiving court accompaniment. Am I saying that right, Bert? Okay. By advocate.
In terms of the counseling piece, the one part that doesn't encompass is that is all counseling by our in-house therapists. It does not include the program we developed where we pay copays, out-of-pocket costs, deductibles, that kind of thing for anybody needing to see an outpatient provider, either because they need someone who speaks another language or they need a specialty, or we just don't have room and we didn't want to have a wait list. So that the actual number of therapy sessions that we are paying for is much higher.
Sorry, I'm not sure if you can hear me, but could you also provide, if you don't mind, how many therapists actually make up who is providing the therapy to individuals?
So currently we have 2 therapists. We have a social worker and an art therapist, and those are our only 2 inpatient or in-house counselors. And we have partnerships with 17 to 20 different outpatient counseling agencies in the community that we refer to for the overflow.
Thank you. Now we're going to move into FCC. I just would like to say FCC did our job for us and actually created these graphs, so thank you. So we have the amount of individuals that FCC served by year. Light blue is 2019, navy is 2020, 21 is going to be that yellow, that red orange is 22, and once again, the green is 2023. So 2019, obviously,
Sorry.
2019 by far has the least amount of individuals served according to the data. And then this graph is the individuals that were not able to be served by year. So same colors, but the opposite of we served them versus we were not actually able to serve them. 2021, there is a huge spike of individuals who could not receive services. And in 2021, of the individuals who did receive services, I think that was the second highest year with 2,400 or 2,046 individuals who did receive service, but 350 could not receive service.
To speak to that and what we call like the bottleneck effect in the shelter, people weren't moving out or we weren't able to move individuals out fast enough into housing, get them stabilized. So we weren't able to bring in more individuals to get them services.
Was that strictly with shelter or overall?
That was mainly with shelter.
I have a question on that. So, because I know 2019, well, not 2019, I know 2020, there's still going to be that pandemic effect. There was the federal funds that were released. It took some jurisdictions a little bit longer to get those funds out. So can you speak to how the pandemic and or if it did, how the federal funds from Treasury either helped or prohibited your ability to move people in and out of shelter? Were you seeing people who were losing that might be here for because of something that had happened during the pandemic, or is just what's the anomaly?
So mainly, a lot of it was, we had a lot of individuals that were back rent, back bills and things that some of it couldn't be like astronomical numbers. So we can't place if they can't get into the spaces. So that's main, we had to extend individuals that were in the shelter, therefore not being able to bring in the people.
Some of it might have been because during the pandemic, they couldn't work and therefore weren't being paid.
But all of those things are playing right into this. So I don't have access to money right now. I can't, my back rent is super far behind. And we're talking BGE back rent, all of those numbers are, we're talking thousands of dollars. So not 1,000, but 5,000, 8,000.
I know if they had left, the likelihood of them actually even receiving the funds to pay the back rent, if I had now vacated the unit, you could not. So now you have the balance, you have the record, can't work, and I can't get a security deposit. Because also the Treasury funds were flexible, but like we had some, I don't want to say we had some issues using it for security deposit. However, the intention were back. So
I think there was also a supply side problem because there was an eviction moratorium. So units weren't turning over, right? So the types of units that lower income people might have been able to access weren't turning over. So that was also a challenge. Can I just ask a quick question? I didn't ask this of the others, but Shelby, is this only victim data or the AIP services in here as well?
All individuals, this is all served. All served.
Okay. And you did have some turnover in your AIP delivery during that year too, I think.
No, we went straight through.
They were taking turnaround clients for a period of time.
I thought you, okay.
I see Lisa's hand is up there. Lisa, if you want to jump in.
No.
Yeah, just kind of going back to the pandemic conversation. I think the other thing that we're feeling now is, in addition to sort of everybody was kind of held in place during the pandemic without fear of eviction, and a lot of bills weren't going to be called due during the pandemic. What we're now seeing sort of as a negative impact is we have seen a windfall of survivors that are looking for shelter, emergency shelter, and ultimately are then looking for housing and affordable housing, who have severely damaged credit. They don't have a landlord recommendation that they could pull on because they weren't paying rent throughout the pandemic and then couldn't catch up when sort of the clock started ticking. And so we've got a lot of folks with really messed up credit without landlord recommendations that just have greater barriers to really being housing ready. So to Shelby's point, like, we can get people in, but getting people out even this many years past the height of the pandemic, we're still feeling the impact of that because of the sort of the paperwork readiness for people to be housed.
I also know in that period of time, it was very difficult for the county to meet their financial commitments to some of the nonprofits, maybe because of federal funds that were bottlenecked or not being provided in a timely fashion. And so I know that many of the nonprofits serving our survivors were living on fumes themselves. I don't know if that affected their ability to serve or not. I can't imagine it didn't affect their abilities.
Hotline calls. So we have hotline calls. We see the gradual increase from 2019 until 2013, with a gap, so to speak, between 21 and 22. 2023, you all saw the highest amount of hotline calls over the past few years.
It's to note, during that, COVID 21 and then the 22 is when FCC started becoming the hub. So all these calls, we partner with like Turnaround and the Dove and individuals. So all of these calls are reflected in that as well.
The coordinated entry board.
Yes.
Total number of calls.
And this encompasses every call that has come through FCC, honestly.
AIP.
Steve, user intervention program.
Huh?
User intervention program. Just the acronym.
So we have AIP from 2019 to 2023, as well as participants that did not complete the program.
We've seen a downshift in individuals that have participated in AIP, and I don't know honestly whether it's individuals not being court ordered to AIP, which is one of the bigger issues. Anger management plays a part, as in they're being referred to anger management when they should be in AIP.
When was the mandate changed? Was that somewhere within the
Judge's discretion.
Yeah, we don't have any control of that.
So then we're discussing.
I'm confused. AIP is different from anger management?
Absolutely.
You don't know whether these are court ordered or voluntary.
No, these are individuals that are in this scale right here are, majority of them are court ordered. Our number of individuals who voluntarily sign up are super low. But these are court ordered, but what I'm speaking to is that downshift, where the referrals for, we know that abusive behaviors are still taking place. Individuals are being arrested. Where are the referrals? A lot of them are going to anger management or just not being referred at all.
So I can offer up, so all the referrals come through DSS, because we handle the domestic violence referral program and then make the referrals out. So I don't know the numbers off the top of my head, but I can check to see if we're getting fewer referrals, well, I guess they are referrals.
Yeah.
If we're getting fewer from the court, that would explain this. If we're not, then we gotta figure out where.
Could it be because there are more programs available and they're
No.
going other, no?
This is the trend across the state. My office certifies the AIPs, and it's happening. I think it's just education, honestly. So this year we did present at the judges conference, and hopefully we'll continue to do some more outreach.
This is still like half of the population is not completing, at least the last 2 years. Right?
Yeah.
And then what happens?
Nothing.
It depends on what they refer. So if it's that case, then nothing's happened. They're
Or violation of probation.
Yeah. They go
Which
back
is
to-
still not a lot of
Yeah.
sanctions. But this is also a priority of the Governor's Family Violence Council. We have been working with Department of Public Safety to have better oversight of AIP. There was a work group in 2015 that asked to track the completion rates and the violations around AIP. That data points have been added in 2020. It took 5 to 6 years to add, and they're still not using them. So we're working with them to better track their clients and, well, their clients. And to show, because what we've been seeing is that probation will be just removed and not extended when they don't complete. And so we're trying to work with them to have better oversight.
Sorry, but when you say they are still not using the data.
The agents, the Department of Public Safety agents, like parole probation agents, like they have the system to track the outcomes and they don't use them.
Well, I mean, there are some judges who will see the violation
Yeah.
and say, all right, 60 days in jail, probation's over.
Yeah.
And that can happen, I would think, a little bit.
Yeah. which is also why we want to educate judges, because I know Lisa probably is raising her hand over there. She, me and her did the training together, and there was data that says that if an individual completes, it has lower recidivism on domestic violence as well as criminal violence as a whole. And so, you know, we'd rather see them complete the program than get jail time. So have their probation extended to complete the program.
And the
Also-
great thing about Lisa with the House of Ruth was that she would notify the judges individually, and the House of Ruth wouldn't wait for parole and probation to do it, which was always really great and welcome when I was
And controversial.
Well, I loved it because I didn't have to wait another
I know you
4 to 6 weeks.
Judges either loved it or hated it, right?
Yeah, we would find out really quickly, and then we could set it in. We didn't have to wait for parole and probation. You know, so there was cutting back some of the bureaucracy.
The other challenge is that we've taken away the judicial discretion in terms of sentencing, is that now failure to complete an AIP is considered a technical violation of probation, where for first offense, I think they can only get a maximum of 15 days, I believe.
15 days.
So it's something that we really kind of need to go back to look at in the legislation.
Out of the Justice Reinvestment Initiative.
Exactly.
Under Governor Hogan, right?
Well, as you're aware, they are rethinking a lot of
Yes.
those justice reinvestment items.
Yes.
And that might be one to put on the
Yeah.
radar.
Trust me, Brandy in my office, who runs JRI, is in the office right next to mine.
Okay.
Yeah.
And have you also talked to Dr. Jackie Campbell about this new abuser intervention program that she is starting to advocate? I would just recommend, it's kind of complicated, and I don't want to waste anybody's time here, but she's right at Johns Hopkins, and she's such a great resource. She was explaining it to me. It's a little bit intricate, but it kind of focuses more on positive reinforcements, not that negative reinforcement. Obviously, if you're an abuser and you're using violence to control a relationship, you should have negative ramifications, but it's started with the VA, and I just would strongly urge that. Lisa, I don't know if you had heard about it either.
Yeah, it's the Strength at Home program. Yeah.
It's that program.
Yeah.
Yes.
Yeah, it's a little more complicated than that. They actually wouldn't meet the state of Maryland's guideline. They don't meet the minimum guidelines for certification in the state of Maryland. And we've given them feedback and suggestions on how they could do that and make themselves eligible. And yeah, we've been back and forth with Casey about it. We can go offline on that one. I'll follow with you, Katie, on that.
Thank you. Thanks.
No, this is exactly the kind of conversation that we hope we want to have, right? Is based on this data, using it as a starting point for the kind of conversations about, right, like, why are the numbers going down in terms of in 2023 total number of participants? Why was there a low completion rate? And then, those conversations I think are really the best part of what we can get out of this working group in general.
That's it. The other part about this, when we talk about those that did not complete, those are individuals. So it's not just individuals that were administratively discharged, is what we call them, whether it was like something medical or they couldn't fit the program. But termination wise, if you go over attendances and things like that, there's a termination, and it's not to say that you can't come back. We welcome, but if they're going to be referred back, it's something different. Things like that.
I would talk to you, Mark, to see how many people are referred to this.
Yeah, I already sent it. I'll get you the DVRP referrals that we receive.
I'd be curious.
That's not just for our program though.
That's fine.
That's for all.
Yeah, no, we. County here, there. Yeah. All right, next slide. Okay, so.
This is small font even on my. We
So this is
working with
a breakdown.
PowerPoint's limitations.
This is a breakdown from 2019 to 2023 for FCC programs. Navy blue is going to be the new behaviors program that you offer. Advocacy is that blue, that lighter blue. Orange is shelter, purple is counseling. The navy, the darker blue, is going to be rapid rehousing, and green is going to be
I think this kind of explains
Yeah.
itself here. If anybody has questions.
Yeah, this is I think of any of the slides for FCC, this was the one that I think jumped out from my almost layman's perspective of seeing where there's a massive level of demand being for shelter and housing in general falling under that. and something that's consistent with the other conversations we've had in this working group, that there's not a lot of options, and it's a major source of demand for the providers.
Shelby, what are you guys considering advocacy versus aftercare? What is the distinction?
So advocacy, any court outreach, court accompaniment, anything like that. But aftercare is basically you come, yes,
Okay.
anything after that.
I didn't have the geographic breakdown, so this was what I was referring to, Mark. So all of the different jurisdictions, whether they are in Maryland or outside of Maryland, that FCC is providing assistance to. So Baltimore County, I believe, actually, you would not mind off the top of your head if you know which one is specifically Baltimore County. It became a little difficult.
It looks like dark.
It's the big one. It's the big. Okay.
Orange one?
No, that's Baltimore.
It's big.
The big blue one.
The big blue one.
The big, almost navy blue wasn't.
Who got assigned a case in Maui?
Oh, they gave that to me.
Good work.
Yeah.
Work.
Only had to go 3 times.
And this is all based on information that is self-reported from our clients. Some of it we won't have, individuals don't want to give that information. So.
And that was something that that struck me too as a possibility, is that if you're in a abusive situation, you may not want to provide, or you may not have a reliable mailing address that you want to put down. I mean, if it's the place where the abuser resides, that may not make sense. And if you were in kind of a transient situation between different addresses, potentially staying with friends, staying with loved ones, right? Homeless is, it's just not going to be, you're not going to have an easy answer for the address.
House of Ruth. So by year broken down, as well as the services provided. So all other services, which is inclusive of trainings, we have hotline calls, shelter services, plus hotel. And that is for the number of adult little children. Case management, and then services requested, but we're.
I guess that,
Service providers, are we able to dig deeper into the data and see services provided for folks with limited English proficiency?
So I'll tell you right now, we had not been responding to that need. The need just arose like on our side of the county, where we're seeing increased services needed for the Hispanic population. So in our response to that is hiring a bilingual advocate to be able to get those services to those individuals. So our data does not reflect that, but moving forward, we will be able to.
So that does not address the needs of Latino folks that do not speak Spanish, right? So what are the services available to folks that speak other languages besides Spanish?
I can give you a breakdown.
All of the organizations, not just you all.
I think it depends, when you get into the data and data querying, it's going to get down to how we ask the question. What I feel confident we can break our data down into is we can clearly provide information about the language that we provided the service in. And we can also provide data on our service recipients' primary language. They don't always match. Sometimes somebody might speak Urdu, but also English, and we provided the service in English. But we can send it to you on both ends. We can break it down.
We can break it down as well.
Thank you.
Dove can also break it down. We use the language line for interpreter services.
And we can as well. We have an advocate who is trilingual. She speaks Spanish, Hebrew, and English, and then we can break it down further.
Would you send us the questions specifically?
We'll do that. Yep, I'll ask that.
And GBMC is able to use CRCOM, which is phone interpretation as well as video interpretation. So we can also do sign language.
Is that like language line?
It's kind of like language line, except it's specifically for the hospital.
So I guess to add on to Juliana's question, which is, can you restate your question specifically?
Are we able to dig into the data to look at services provided for speakers of other languages besides English?
And then kind of a caveat to that, what are so you use a computer system, someone said, it's like being able to name what that specifically is, if possible. And then I think we have one more group. Was there anything, anyone representing House of Ruth that you did want to chime in on? We have one more for turnaround, but I didn't want to skip past that.
Yeah, I'd like to just add some context. Confirming just what Alicia said, what we're seeing with the LAP, that we are seeing a reduced number of consent for follow-up from survivors. In Baltimore City, that's leading us to look into kind of retraining police around engagement. But also, I want to echo sort of the challenges that are facing the families that are just becoming more complicated that Alicia had spoken to, especially in the context of a greater sort of national demand for mental health, as well as the affordable housing crisis. Karen had made a point about ability to serve in the context of funding challenges, and I think that's really important. Our greatest challenge at House of Ruth right now is our lack of ability to continue to pay a living wage as that number increases, as well as offering competitive salaries, particularly for licensed clinicians in the face of reduced or flat funding. House of Ruth Maryland receives funding from Baltimore County to provide peace and protective order representation, as well as some limited funds for outreach to the Latinx communities. We do have counseling and legal services in 3 jurisdictions in the city, but we are only Baltimore City's designated domestic violence agency. Turnaround and Family Crisis Center are the comprehensive agencies for Baltimore County. So the numbers that you're seeing here, and these are only our Baltimore County numbers, these do not include our city numbers. We are not eligible for most of the state funding that supports this programming. Therefore, the numbers that you're seeing really is overflow. So, I've connected Henry recently with the Baltimore City's mayor's office to discuss this because we've been seeing an increase of providers who want to expand into Baltimore City are then creating more pathways to our shelter, but not offering shelter services, and being very vocal and very critical about our ability to meet the need of Baltimore City and the number of people that we have to turn away from our emergency shelter. I don't have an answer to this yet, and I want to make sure that we stay at the table in a collaborative environment. But we are kind of carrying a burden around shelter for Baltimore County, which we're happy to do in a collaborative way, except that it's opening up a criticism from our local service community that we are kind of funded to provide that service to. So I'm hoping, Henry can connect with the mayor's office or the service providers in these jurisdictions can kind of talk about this a little bit more, because we're carrying a lot of the shelter overflow while also catching heat in Baltimore City for not meeting their need.
And that, I think, gets to something that I would like to see a meeting on in 2025, which is the cross-jurisdictional question, because Baltimore County is on an island. We have invisible lines between ourselves and other jurisdictions, and making sure there's communication there and to better. And again, I'm still thinking of the best way to sort of broach that conversation here, but I think it's definitely an issue because, obviously House of Ruth geographically not, out here, but also that there are people who live right between the city and county line, and they're going to, or likewise on the Carroll County line or on the Hartford County line, and they may seek out services in those jurisdictions despite being a resident and taxpayer in Baltimore County.
Just to add to that, I think with the increased capacity of all of us to provide remote service provision and the decreased availability of resources, many victims and survivors are just going to the National Domestic Violence Hotline. Frankly, we get called first a lot because C is first in the alphabet, and they're just going down the list. So I think that whereas before the pandemic, there was a lot more thought of, oh, I live on the east side, I'm going to call Family Crisis Center, or I live I live in the more central area, I'm going to call Turnaround. I think more victims and survivors are just calling everywhere.
It's a good point.
Well, and quite frankly, that's how we've messaged. Like, we haven't been clear during COVID and since COVID, really, in how victims could best access the services. We do fund through the COC, coordinated entry system, but I don't think we've done a very good job of fleshing that out and using it. So, and I'm not being critical of anyone. I think it's all of us. So, I was just going to comment though on the comment you made earlier about the overflow, the shelter overflow issue. I think it's broader because it's not just within the DV shelter systems. In our homeless shelters, we're also seeing lots of victims, and they're ending up there, I'm sure some of them, because there's no room at the other end, right? So that's just I think, how we talked about housing already. Housing is going to become a bigger and bigger challenge, and how it drives people accessing these limited shelter beds.
Yeah, and Baltimore County seems to have a double whammy. I mean, I know Family Crisis Center made a really concerted effort to get new territory for a shelter, and for a lot of complicated reasons that didn't go through. But Baltimore County has, you know, considering the size of the jurisdiction, has a relatively small number of shelter beds available. When then layered on top of that, the affordable housing crisis, I think you're getting it kind of a double whammy here in the Baltimore County area.
And I think that the housing that we provide for families, shelter housing, many of them are our survivors. They have been, they know not to identify themselves.
Right, move on to turnaround.
So this is. This is our last slide, I believe. So once again, from 2019 to 2023, this is all specifically for Baltimore County. So we have services received, served by CET, served by direct victim services, by clinical, by advocacy, BGC, by crisis, called received, and served by me.
CET. Our community education. So going out. And then I realized I got a lovely email from Henry saying, I don't understand because there's some things in parentheses, which there were, and I'm so sorry that I did not email you back.
That's okay.
So these are new referrals. These are not ongoing service provisions. So those numbers are a little bit higher, a couple hundred higher for those that were already engaged in services at the beginning of the year.
So you're seeing a continued increase in AIP?
We are. We also just stacked up, and some of that is we started a youth AIP program, which is somewhat unique, trying not to step over or step on top of the partners that were already doing the service. The competition for AIP doesn't make a lot of sense to me. So what we did is kind of fill the gap in terms of youth-based AIP. So we're partnering with TJS.
And so do you have the numbers of, so served by AAP, do you have those that completed?
I can get them. I do not think I have them in the data set that I have in front of me, but I can get those for you.
Do you think in a subset of adult versus juvenile, do you think you have a decrease in adult, but the juveniles, what's accounting for this?
I don't know that off the top of my head. And this is just like several, this is just the Baltimore County numbers. Any questions? I don't, to give context to this, I mean, it is what it is. I think we've seen 4 or 5 of these already.
Yeah.
Clinical services, and I'll just echo Lisa said, like we can't keep staff for our clinical services because the requests for salaries, I mean, I'm close to what I'm making in salary, what I would be paying for a clinician. So we've just had a really hard time being able to maintain based on the funding that we have, and also I think what's happened in the field. The biggest growth when we continue to look at data internally is that advocacy and community-based case management. That team has grown exponentially over the last 3 years, and every year we can see that need continue to grow. So that'll be a place that we continue to fill in. And then when it says served by crisis, it's on our crisis hotline. That's just shelter services. Crisis by shelter.
Is shelter under services received or?
Probably. Yes, that sounds right. So yeah, they would all, everything would be included in that. So
We got the, yeah, here, but I think it might have been, placing slide by, yeah,
Okay.
okay.
So-
The other, that was a duplicate. All right. Good. Matt?
Amanda, our regional navigator services just sprinkled in there. Is that they would be in there? Yeah.
Okay, so again, I want to thank all the providers for that data. That was extremely, I think it was a large ask we made back in the summer, and I appreciate the transparency in providing it because I think much like with the police department data, getting a visual for this conversation and data for this conversation is very important for, again, having kind of tangible information to rely on, because I think that everybody in this room has their experiences and their perspectives they bring, but it's always good to have that information in the back of our pocket when we're looking at and discussing solutions. And that is not to say that there's not immensely more to cover, and we will in 2025, but the hope for the rest of the fall, really for this meeting and for the next one, and I'm not expecting today to have a thorough, in-depth conversation as much, but to get the conversation going as to policy recommendations for for Baltimore County government. One thing, and I'll get it started by saying I went back and reviewed the prior meetings, and one of the, I've said it before, but it seems like the number one area that has come up repeatedly is and Lisa described it well, the housing challenges we have in Baltimore County, both in terms of the shelter, the affordable housing, providing shelter, and the challenges that creates where you have people who can't have the choice of ultimately either moving back in with the individual who is the abuser or trying to find a new place to live, and oftentimes having to relocate out of Baltimore County, which is a very difficult thing to do for a family, particularly when you factor in young children. So that was definitely one of the issues that I saw there, which may be worth including as a policy recommendation. As Juliana mentioned, the need to provide services in both internally and with the external providers that meet the growing diversity of the county in terms of cultural and language background. And again, as always, the challenge of grant funding and other streams of revenue for revenue is not the best word for it, but funding for the providers to be able to meet the demands of staff and be able to offer competitive salaries and salaries that allow for retention of people who are doing good work and doing important work. And then a final one that again, this is based on my review that came to mind, and I've discussed this with a few people in this room, is providing something internally through the county website, which provides a list of providers, a description of what the providers offer, their address and geography, and then also information from the law enforcement side, because you're going to have people who are, yes, they may need services, but they also need the sort of instantaneous, what's the steps for a protective order, where are the police precincts, and so on. So that's just, again, a conversation starter there. I see Alicia's hand is up. I want to make sure I get her first here.
Just one thing, one nuance I just want to bring to the housing aspect of things is, sorry, I'm trying to figure out how to lower my hand, is that what we have seen a lot of, particularly over the past 6 months, with our elder abuse clients, whether it's older intimate partner violence or elder abuse by an adult child or grandchild or loved one, is that we are seeing a lot of older adults whose adult children have moved in with them because of the financial climate. Then when abuse happens, they may or may not want to access the protective order because since this is their child, they are concerned about criminal repercussions of it, even if the crime and abuse is happening. And then frequently there will be people who are not related to them who are also living there, whether it's the adult child's boyfriend, girlfriend, whoever, sometimes their children, whoever it may be, so that the protective order and the peace order process wouldn't give them that relief even if they wanted it. So then we have these older adults who are not particularly comfortable accessing the legal process as is, having to access not only protective orders, but also the eviction process. And then when the eviction process can really take some time, it doesn't really avail them of that safety component. So I would, I think we've all been sort of talking about anecdotal trends that we've seen here and there, but with our older adult population, we have seen a lot more older adults who have had to avail themselves of the eviction process as well.
That's very helpful to know. Yeah.
When we're talking about shelter, also, like, I believe that there's somewhat of a national trend looking at a variety of different shelter options for people, as opposed to what we traditionally know as like the domestic violence shelter, where you're placing someone for a period of time and then helping them get back into the community. And so I think as we're having that conversation, I think it's important to also include that. We're spending a lot of money on eviction prevention or first month's rent and security deposit because people want to just simply get out and move somewhere else. Rapid rehousing is something that I know FCC utilizes, and we run out of that money every single year. So I think that there are a variety of ways to talk about housing in this space, and it's not just a shelter.
Right.
Because that may not be the best option for our community. I think it's something that we need to think about.
The profound data that we went through today, is that going to be a permanent Baltimore County stat so that all the providers around the table are providing those on a monthly or annually basis, so that when we look at county stat, they include all of these statistics plus the drill down as well?
So I'm gonna defer to him. This is his work. We're just here to help with the visions of the day. But I think internally it is something that we could do monthly. If we wanted to open it up, I think that there would be some other conversations that we would want to have to ensure, one, that you as our partners in this process, we never want you all to feel blindsided. And we really do appreciate the collaboration that these spaces bring us. When you say a monthly or annual stat, are you saying like a report that goes out, or what do you envision for that?
However, Baltimore Stats works, you work it in with all the providers in the county, including maybe our legal partners, our police partners are already there, I believe, correct? So if we're trying to look at trends and connect the dots, and we know that the data is helping us see that, and it's common to all of us, that should be part of county stats. And it should also be a part of Maryland stats. I don't know if it is, or if we have such a thing. We can certainly start with our county, but I would hope, however you get your stats and whatever period in which that is, and it's not too difficult for the providers to provide that in a way that's applicable to the system in and of itself. I would hope that this is just the first annual or first set of stats that will be a permanent process in Baltimore County.
Henry, I think that we can follow up offline and see realistically what does that look like.
Yeah. No, I think, Amy, to your point, I think it's a good, we can't evaluate where things are with that data, right? So I think we definitely want to have a way to continue to review it, come back to it. So we'll, like Joyce said, talk offline, but the best way to make that practically work and the best form for it. But I think it's a good suggestion.
I do want to add one thing though. So we have had these conversations. So we are obviously having this conversation in this room with us. We did have the opportunity to put some data to the CE and the AO. So that what we are discussing in this room doesn't stay in this room. Because yes, we are the individuals who are working and trying to change. We don't want to stop. So we can determine the best way to continue the conversation. But I don't want you to think that this conversation is happening in a silo and then it stops in this room.
Well, I mean, as far as data collection, I know that nonprofits like Women's Law Center and Turnaround and House Breach, we all have quarterly reports that we have to do. And we have to let our funders know how we're using the funding, how many people we've served. So that's all goes to like the Maryland Legal Services Corporation and to AOC and to OCAP. They get all that information. They can share that today, can't they?
Yes, we did provide Henry with your numbers, and I didn't look at how long that was. It was a spreadsheet of 600 rows.
Sorry, that's all.
It was.
Sorry, Henry.
No, it's.
Yeah, I mean, it goes into detail, especially
Yeah,
with
it
the
does.
immigration services. So it talks about the individuals, the languages that they speak, and the process and where they are in the process with immigration can take up to 10 years. But with the other projects that we do, like divorce, custody, and the protective orders, all of that quarterly goes to our funders, which directly is the state, federal government. So I think it's available for state government to see, because it's, we're using taxpayers' money and we need to justify what we're doing with it.
That's right.
We need to see the overlap. I mean, I'm curious to know, and I don't really want to know, but how many of these survivors of child abuse are their parents are experiencing the same in the home, and who were survivors themselves as children, right? There's patterns here, and they're generational. And we've known that. I've known that in the lifetime that I've worked in this field. And so we're here, and part of how we got here is because of the past, and the question is, what can we do to heal? Hurt people. So how do we, keep drilling down in the services in which we provide now, and the trend doesn't go up, it goes down. And I'm most interested in the overlap geographically, legally, counseling, services, the age when we start, and sometimes when it never ends. Because I think that we can also see there's overlap in funding, right? And so how can we be better coordinated with the profoundly restrictive resources that we have? So that's why I was hoping that the stats would tell us the story.
And from what's already available, and this is more looking at the BCPD data and overlaying that with where you have higher instances that the stat page already provides online, things like, yes, the instances where there are the most numbers of service calls for service, those precincts often have communities that have higher rates of poverty, addiction, crime in general. So I do think it's, and in a lot of ways, the $1 million question, which I don't think there's an answer to today, but it is the best path forward in regards to what can be done to better drill down, right? Because getting this data is extremely helpful. Then there's a challenge of the depth beyond that level, I think, is where it gets trickier to zero in. But it's very important that we do that. We'll find a way to get to those underlying issues that you mentioned. So being cognizant.
Excuse me,
Yes.
Lisa's hand was up.
Oh, okay.
Took it down, but it was up.
I mean, I think you guys have all basically gotten to it. I mean, I just am a real proponent of like knowing the research question, or what's the question we want to answer before we start asking programs to pull data. We're all holding data and we all have data sets. But you also heard us all talking about how staffing and turnover is a real challenge. And I'm coming from one of the largest agencies that has the luxury of having a data team. I'm thinking of the smaller, specifically the culturally specific programs, that this is a real burden on and the data pool and asking that. And so while yes, I'm all in favor of transparency, sharing the data, I would just ask that we formulate our question rather than just all data all the time, because it is a lot for the programs.
Right. And that's part of the conversation, I think, Joy and I.
Well, it wasn't to burden our
Right,
providers.
right.
To assist them in their.
Yeah, it's.
Yeah, I would
Yeah.
love a data team. That would be fantastic.
You're looking at the data.
Yeah.
For CVMC.
To be fair, my team is 1.5 people. It's not like a, it's not a basketball team or anything.
Better than zero.
That's right. So again, just like I mentioned, being cognizant of folks' time and that a number of people had to step out for other meetings. What I would ask ahead of the next meeting on data and on policy recommendations is that if anybody in this room has anything ranging from 4,000-foot view to very specific as far as recommendations, if you could send those over to me ahead of the next meeting, so that way, just from like a formatting standpoint, getting them prepared so we can get them on the screen as discussion points, that would be extremely helpful. Not to say that you can't bring something up off the cuff, but it's useful for the practical meeting planning standpoint to be able to have one. And also if you have any questions that are somewhat tied to this, in terms of saying, is there X, right? Or what are the numbers for some category? That again, the more notice you give and the more time we have internally to discuss, the better. So that way we can come from my end, or I can come to the next meeting with everything that I need in order to help facilitate that conversation for policy recommendations. Because I think that again is really the hope from where I'm sitting from year one, is to have things that we can tangibly recommend so that the council, executive, and our partners in state government can have something to chew over and to look at as we head into, again, acknowledging that budget season for the county is coming up before we know it. General Assembly session is coming up before we know it. The more we can have to recommend that is tangible and can offer something to the lawmakers, I think is always for the better. And again, acknowledging that some of these conversations and policies may not take or may not be able to get done immediately, but to get the ball rolling on them, the sooner we can do that, the better. So unless anyone has any parting thoughts, questions, comments, I want to, again, for the third time, thank everyone for providing the data. And I really want to thank the BC Stat team, Joy, Cello, and others internally for the work that they did in taking these numbers and putting them all together so that everyone here can really look at them and discuss. And we'll circulate the presentations to the members of the working group as well.
I just want to add a quick comment, not a recommendation, but the first slide I thought was pretty impactful that talked about total number of services. I think it's a trend that we're seeing across the state where it was about 4,800, 2020, it was 3,300, and then 6,300, and then in 2022 and 2023 in the 7,500 range. That number doesn't seem like it's dropping. And so that's why, everyone's saying they have need for increased services, and that's across the state. And I know funding is dropping as well. So it's a battle, but I just want to make a note that, that's not just Baltimore County.
And I just want to, I know it was mentioned before the meeting started, George Massini is retiring. And I know so much of this is relational, and George is really who helps bridge the gap because of the geographical way we're broken up with DVCs. We're working to identify somebody that is a priority for us in the police department. And in the meantime, if anybody needs anything that George would normally facilitate for you, please reach out to me, and we're working to get somebody in our shop to spin up the village for you.
Well, thank you everyone who came here in person, and thanks to those of you who joined on WebEx. I hope everyone has a great rest of your Monday and great rest of the week.